Our speaker today is Chuck Lubelczyk, who has worked for the Maine Medical Center Research Institute since 1994. He studied ecology and the health impacts of ticks and mosquitoes across Maine. When I first contacted Chuck last summer, he was somewhere in the deep woods doing a mosquito research. So he's out there with the insects. He graduated from University of New England with a master's degree in public health and is currently a resident of the Maine Coast area, where he lives with his wife, his dog, and 3 ungrateful cats. I can totally understand the cats. They just take you for granted. So with that, Chuck is going to enlighten us today all about ticks.
Yes. All right. I'll try sharing the screen.
There we go.
Okay, so this presentation is actually one that our lab does in coordination with the Maine Center for Disease Control in Augusta, our state health department. And our lab, the Maine Medical Center Research Institute, has been working since the early 90s on tick-borne and then later on mosquito-borne disease issues. We have work that we do statewide, so we work all the way as far up as Aroostook County and Presque Isle and Fort Kent. And have partners all the way over Machias, all the way back down to York County. We work on the coast in Wells and Kennebunk quite a bit. And so our lab is, we kind of have a lot of different hats that we wear, but essentially, you know, the people that I work directly with and conduct research with do a lot with environmental aspects of tick and mosquito-borne disease. The head of our lab, Robert Smith, is actually a clinician, but the most of our staff are actually made up of people who come from an environmental science background. And so we do a lot of work looking at the distribution of ticks and mosquitoes, testing those ticks for pathogens, and then looking at kind of the wildlife and the habitat issues governing why ticks and mosquitoes are where they are. So we do a lot of work, for instance, with invasive species, which seems to be an important habitat component for tick research here in Maine, and then also work with a lot of wetland ecology issues as well. So basically, this talk is really going to cover ticks, which is not quite our state mascot, but certainly in the last 20 years, you know, it has become very much a public health and a veterinary health issue across most of northern New England. And a lot of what I'm going to say today is going to be very applicable to what goes on in New Hampshire and Vermont, as well as probably the Canadian Maritimes. And also a lot of what I'm going to talk about today, even though there's going to be a focus on human health, there is a strong component of this that is also a veterinary health issue. And so a lot of the issues that affect us clinically from tick-borne diseases can also affect many of our companion animals as well as livestock. So just keep that in mind as well. So we suspect that we have somewhere around 14 different tick species that are potentially found in Maine. We have 3 that are probably of the most concern that we encounter regularly. The first of this is a tick called the deer tick or the black-legged tick. This is a tick that is a vector of Lyme disease, and it's probably our most important tick from a medical or veterinary issue that we have in the state. The tick season for deer ticks is just starting. You know, we actually were doing some survey work in York County this week and found that with still a lot of the ground frozen, the tick numbers really haven't started in a big wave yet, but I suspect in the next couple of weeks, as we get some warming temps, that we're going to see quite a bit of activity cropping up. Another tick that we work with is called the woodchuck tick, and this is a tick that carries a virus that I'll talk about later on called Powassan virus, and it's not a tick that we encounter a whole lot unless people have evidence of a lot of wildlife living close to their homes and in direct proximity to where they're having some activity. So for instance, burrows underneath the shed, or possibly an animal denning under a foundation or porch may have this tick on it. And so they can, in some cases, get on people. And then finally, we have our most common tick that we see across most of the Northeast called the American dog tick. This is a tick that is very common in the springtime. Its season is quite short, but when it is out in pretty high numbers in a lot of years. And it's not a vector of disease in northern New England yet. It does transmit a disease called Rocky Mountain spotted fever as you go to the southern parts and the western parts of the US. But at least in northern New England, it's more right now just a nuisance issue. But it is something that people find a lot of when they go out in the springtime into blueberry barrens or fields, this is the common tick that people find is this American dog tick. And you know, it's not uncommon for people to go out in early May into an area like an old field, and they come out with 60 or 70 of these ticks on them after only about a minute or two going out in the field. And so the American dog ticks can be quite abundant. This is just a difference showing the scale of size between deer ticks and dog ticks. And overall, in general, deer ticks are going to be quite a bit smaller. I'm going to go into deer ticks and their sizes a little bit more in detail a little bit later on. But the one thing to really look at is if you're looking and you find ticks on yourself or your companion animals as you're coming in, if you can make out any kind of white on the back, which you can see from the bottom line, these are a pretty good indicator that they're going to be dog ticks. Even if the tick has engorged on your pet, dog ticks still have some kind of white on the back. And so the males on the far left have like these white stripes going down in parallel. Females have this whitish shield behind the head. And so they are going to be noticeable, and they're going to be quite a bit bigger too than the average deer tick. One of the things about deer ticks that people talk about a lot is that they are the size of the head of a pin. And so this is just a photo of a deer tick nymph, which is the life stage of the tick that's out in the summertime. And you can see compared to the tip of a lead pencil, how small that tick actually is. This life stage of the tick as well is the one that's most responsible for human cases of Lyme disease. And I think in general, it's because these ticks are so small that a lot of people don't find them on themselves when they're coming in from out of doors. And in general, you know, obviously doing tick checks is important, but finding these ticks early, especially if they have attached and are feeding, finding them within 24 hours and getting them off within 24 hours, it goes a long way towards reducing the burden of tick-borne disease. Most of these tick-borne pathogens are transmitted after 24 hours, so the tick actually has to be feeding for quite a while to transmit. So the earlier you get the ticks off, the better off folks are in general. We have another kind of tick that we are not worried about in Maine yet, but we are hearing about that is coming up the eastern seaboard, and this is a tick called the Lone Star tick. It is a very aggressive tick. It actually is a tick that has eyes. So if ticks creep you out, one further reason to be creeped out by these ticks is that they actually will turn and follow people in the woods. And the people that work with these ticks in New York State, where they're present now on Long Island, say that in the fall, they can actually hear the leaves rustling. There are so many of them present on the landscape. And I bring this up because these ticks are actually transported by migratory birds. And there's a suspicion that if these ticks are going to arrive, it's a lot of the coastal peninsulas, which are on the migratory flyways for songbirds, that these ticks may be deposited and get established. And so we actually do conduct surveys for this tick in the springtime. And we do really concentrate on a lot of the coastal peninsulas. So areas really starting in Scarborough and then going up to the Freeport area, Brunswick area, you know, over to my area in Lincoln County, and then all the way up to Knox County. We haven't found it yet. We don't think it's established, but we do think it's going to get here at some point down the road. So this is a tick that we are on the lookout for. In general, though, ticks are not everywhere on the landscape. Each of the ticks I mentioned initially, the deer tick, the dog tick, and the woodchuck tick, they all sort of have their own little habitats that they sort of like. And as a very general guide, in general, deer ticks tend to be ticks that you find really in a wooded area. So you need to have some kind of shade and some kind of protection from sun and wind because deer ticks, they dry out very, very quickly. They don't like excessive dryness. And so areas that have a lot of shade, so a lot of your oak and maple forests with their dense canopy cover, along with areas that have a lot of invasive plants, which form a nice, dense undergrowth, which is also protective for the ticks, means that you can get quite high numbers in there. In general, the activity period for deer ticks, you know, we tend to see some activity starting up as soon as pretty much the snow melts, and this will transfer across the state. So certainly southern Maine has more activity going on in March than northern Maine will, but eventually, you know, these ticks are now spreading to the point where we are seeing them on the barest tip of Aroostook County. So it is really a statewide problem for us. They do extend, their populations will extend into the fall. And it is not uncommon now, especially in coastal areas, to find these ticks out as late as December. if we have a fairly mild late fall, early winter. This past year, as an example, we certainly were getting reports of ticks coming in from coastal counties such as York, Cumberland, and Lincoln County, for the first half of December, where we had no real appreciable snow cover, and the temps were still getting close to 40 degrees on an average daily basis. This tick, as I said, is probably our most important tick, and it carries a variety of pathogens. We know of at least 5 that have been documented in Maine residents. Lyme disease is, of course, the most common. Anaplasmosis, babesiosis, a relapsing fever transmitted by or caused by a bacteria called Borrelia miyamotoi. And then finally, an encephalitis virus called Powassan encephalitis. So with this mix, it means that we really do have these ticks in our radar. And a lot of our survey work and research is focused on where these ticks are going, where they're being found, and really what the pathogen and infection rates are in them. Dog ticks, as I said before, are quite a bit different. They tend to like a lot of open areas. They're very resistant to drying out, so they do just fine in open fields and lawns and forested areas that are particularly dry. So you think of a lot of your pine barren forests that are very dry forests. These ticks do really well in those habitats. They do have a shorter season, however, really emerging in most years around the middle of April, and they go to pretty much around the first week of August, and then their season is done at that point. It's actually very rare to find these ticks after the second half of August because they have such a short season to them. The real peaks, though, are around May and into early June. And again, they don't transmit diseases that we have found in Maine or northern New England. But as you go towards the mid-Atlantic area, going down towards the southeast, they do carry Rocky Mountain spotted fever. It's probably the most common pathogen that they transmit. And finally, the woodchuck tick, again, as I said before, it's really dependent on the wildlife hosts that it gets on. So this tick, even though it's called the woodchuck tick, is found frequently on skunks, other kinds of animals that we would call mustelids, so weasels, so ermine, things like that, fisher, pine marten will actually have these ticks on them as well. But in general, skunks and woodchucks tend to be the animals that these ticks get on that bring them into close contact with people, because these animals, skunks and woodchucks in particular, do very well in a domestic or suburban environment, and they can den. They can find denning sites pretty easily in our yards, and so these ticks can actually get a little foothold in as well. And generally, they're active more in the summer months than any other time of the year. And they also transmit, like the deer tick, Powassan virus, this encephalitis virus that we have had cases of in Maine going back about 20 years or so. And I talked a little bit before about deer ticks and where to find them in the habitat that they're found in. Most commonly found in the southern and mid-coastal regions. And the mid-coast area, really, the numbers have been really, really spiking the last few years. I lived in York County prior to 2015, and a couple of years before that, we really began to have reports of the number of ticks really ramping up, starting in areas like Newcastle, Rockland, areas like Rockport, Camden, Warren. So certainly the area that you're in around Harpswell, Brunswick, Topsom, those areas have been pretty inundated for a while. And we are real still considered southwestern coastal Maine in a lot of cases. So we're looking really at living in some of the hottest parts of the state for tick-borne disease in general. The one thing that we are noting as well with deer ticks, we've been doing a little bit of work related to climate change and how these ticks may overwinter and how a changing climate may affect populations of these ticks. And we do find that when we have years where we have a lot of heavy snow cover, that generally is very beneficial for the ticks. So the traditional thought that even though our historically cold Maine winters, there's not a lot of tick activity during them. Years with heavy snow cover, though, really tends to be very protective for the ticks. And in years when we have had really, really cold temps for extended periods with no snow cover, we actually do notice overall a decline in the following year in the number of ticks we find. So they don't survive sub-zero temperatures very long without a lot of snow depth to protect them. So you can think of snow as a nice insulating blanket for the ticks, along with a lot of other organisms as well. And these are just some photos of what we would call favorable or good tick habitat, deer tick habitat versus unfavorable. So you can see on the upper left, this is actually a photo from a preserve down in York County, but it's a forested space. at one time a fairly open forest space dominated in the canopy by oaks and maples with a thick, almost impenetrable understory of Japanese barberry. And this combination of having these oak maple forests and Japanese barberry, Eurasian honeysuckle, and Asiatic bittersweet is just like tick heaven. You know, we really think of deer ticks kind of having the kind of the really sensitive areas that they like, and the really core areas, and really, you know, kind of think of it almost like a Goldilocks condition with deer ticks. You know, they don't like it too hot, they don't like it too cold, they don't like it too wet, they don't like it too dry. And these types of habitats, though, these oak maple forests, especially ones with invasives, are really their prime Goldilocks spot for the ticks. You know, they really do pretty well in there. And a lot of it is that the Japanese barberry, honeysuckle, and bittersweet really form a nice protective dense cover. So there's not a lot of sun getting down underneath there. And it also is very protective from wind. So it helps keep the ticks from drying out during the drier parts of the summer. By contrast, though, we do have areas that deer ticks don't really do well in. And on the bottom, you can see we have like open dune grass, and then we have like fairly mowed lawns on the right. And both of these, you know, really allow a lot of sun and wind down to the ground, and that helps to dry the habitat out a lot. So the ticks don't actually survive very well in those types of habitats. You know, for this reason as well, you know, we do actually advocate, you know, removing your leaf litter from your lawns and keeping your grass mowed. If you have areas where you have a lot of activity that you're doing in your yard, mowing lawns and removing the leaf litter, and to a lesser extent the shrub layer around where you're actively spending time, is a really good method to help reduce tick exposure. You know, because they really don't like the sun and the wind coming down, and those are going to be safer areas to recreate in, or for your pets or your kids to run around in. And so deer ticks, though, have really been expanding over the last 30 years in Maine. And this is the case also in other parts of northern New England, where we used to have a program in our lab, which has since been transferred to the University of Maine, where ticks can be submitted by the general public, physicians' offices, or veterinarians to our lab for identification. And that allowed us to actually track ticks from 1989 to 2013. And what we saw over that time was this map on the left here shows the state of Maine from 89 to 2000, and the distribution of where deer ticks are being found and submitted from. And then on the right is from 2001 to 2013. And so that later decade of research really showed the ticks were expanding. And this has continued since UMaine took over the program, where they're finding ticks now coming in from areas of the down east coast around Machias and Eastport, the upper western mountains area, you know, northwest of Bethel, going up into Jackman, and then also in Aroostook County around the areas of Presque Isle, Fort Kent, areas like that. Smyrna Mills are finding these ticks slowly establishing themselves. So we really do have an expanding population here in the state. And, you know, this is, like, as I said, the case with a lot of the other northern New England states as well, where these ticks are emerging. This is also the case for other parts of the U.S. as well. And this is just a national map at the county level showing where deer ticks and a western form of the deer tick called the western black-legged tick were found. And the upper map really shows from, I think it's 1907 to 1997, I believe, shows where records were reported of these ticks being found. And from since then, on the bottom map, you can see that the distribution has widely expanded in the U.S., especially in areas of Pennsylvania, going down into coal country, into the Ohio area, and the upper Midwest. These ticks really do seem to be expanding, just nationwide as well as locally in Maine. Generally, with deer ticks, the way this tends to work is that the ticks are actually very much, they're not insects, they're actually closely related to spiders. And like spiders and other arthropods, they lay eggs. And so the deer tick eggs tend to hatch in the woods sometime around the second to third week of August in Maine. And when those eggs hatch, they emerge as the life stage of the tick known as the larvae. And you can see this on the interior kind of spiral of this graphic. And the larvae come out towards late summer, usually around the end of August. And they'll be out pretty much throughout a lot of August into early October. And when the larvae are hatched, this initial life stage of the tick is not usually born with any kind of infection. So we call it a naive tick. That is, it's cleared of most infections, and it's not a vector of disease. However, it does pick up the disease from feeding on wildlife, such as migratory songbirds, such as robins and sparrows, and small mammals such as mice and chipmunks. Those larvae that successfully feed engorge with blood and then drop off and hang out under the leaf litter all the way through the winter and the spring to emerge in Maine, at least sometime towards the end of May, as the life stage known as the nymph. And you can think of the nymph as kind of the teenage version of the deer tick. It's the middle life stage. And again, this is the stage of the tick that causes the most human Lyme disease. And again, this is the tick that is commonly referred to as the size of the head of a pin. And because of its small size, people generally don't find the tick on them very easily. And we tell folks in a lot of ways to know your moles or know your freckles. If you have a new freckle that appeared on Wednesday that wasn't there on Tuesday, and that freckle has 8 legs and it's moving, well, that's a pretty good indicator that it's going to be a deer tick. And so early removal of the ticks does go a long way towards reducing tick-borne disease, though. And so we advocate, as a consequence, things like tick checks when you come in, having large mirrors and a good light source to be able to look and see kind of all your blind spots when you come in from out of doors. Those nymphs that are able to feed successfully on wildlife, again, the nymphs will feed on a variety of animals, including mice, raccoons, foxes, birds, deer. They will fill with blood in the summertime, drop off onto the leaf litter, and then emerge usually around the 1st of October in Maine as the life stage known as the adult. And this is the reproductive stage. And this is the stage that actually helps to procreate and continue the tick population. And these adult ticks tend to come out around the 1st of October, and they will be out until it gets to be about, an average of below 40 degrees for an average daily basis. So obviously the ticks will shut down a lot earlier in northern Maine, than they will in southern Maine. It's not uncommon for us, if we go to Aroostook County for a survey, we really want to get our surveys done up there prior to the end of October, because the tick season there really shuts down right around Halloween because of snow in most years. Whereas in southwestern Maine, as I said before, it's not uncommon for us now to find these ticks active all the way through December in some cases. So, and these ticks, as adults, their primary host, although they will feed on things like coyotes and foxes, their primary host in nature are going to be white-tailed deer. And what we have found based on some research is that the more deer we have in an area, the greater potential for ticks you have, because it's not uncommon for one of these female ticks, one of these adult ticks you can see in this graphic, to feed on a white-tailed deer and produce up to 2,500 to 3,000 eggs. It's not uncommon in southwestern Maine to find deer in the fall, when we can examine them being brought into hunter stations, to have up to 100 ticks on them at one time. And so you can do, by doing the math, you could say that it's possible for one deer to support up to 300,000 young deer ticks coming into the area. And so, of course, the more deer you have in an area, the greater potential for the number of ticks you also have as well. Taking into account other things like the habitat being good, and it being a fairly comfortable year for the ticks. It's not too cold or too hot, but it generally means that we really do see a few times a year where the ticks are not as much of an issue, but certainly it's the kind of thing where you do have to be on the lookout for a good part of the season at least, to keep an eye out for the ticks in various stages. And I should say as well that with these adult ticks coming out, we do tend to have, even though the nymphal ticks, which are on the bottom here, really have their peak activity period in June and July, that corresponds to a lot of human disease. By contrast, the adult ticks that are out in the fall tend to relate a lot to veterinary cases of Lyme disease. There's been some work done in Massachusetts looking at when reports of Lyme disease in dogs were being found, and it really does coincide with when the adult ticks are out in the landscape. And so you have a lot of Lyme disease in dogs being reported around the 1st or 2nd week of October, and really going into the wintertime, and then picking up again in the spring when those adult ticks come back out. So really, this is something that should be of concern to anybody that has pets, because dogs as well as cats can get some of these tick-borne diseases, as we can. And so when a tick bites, unlike a mosquito or a black fly, it tends to be very slow in biting. It secretes an anesthesia, so you don't feel the bite the way you would with a mosquito bite or a black fly bite. And then it has an anticoagulant that keeps your blood flowing. So ticks that we will pull off of, if you're finding an engorged deer tick on your dog in the next 3 weeks, and it's fully engorged, and we're talking about the size of a large blueberry, that tick has probably been on 5 to 7 days at that point. So they can stay on for quite a while feeding. And they're helped by, and you can see in this graphic, the green beak on the tick, which we call that the hypostome, as the anatomy lesson for the day is the tick's hypostome. But it's barbed with a lot of recurved fishhook-like appendages, which help to anchor the tick under your skin, which makes it very difficult sometimes to remove these ticks off of people or pets. It means that a lot of times the head may come off if you're not careful when you're removing the tick, leaving the beak and the head attached to you while the rest of the body of the tick comes off with a pair of tweezers. So we do tell folks that if you're removing a tick, just to be cognizant of the fact that the tick actually can't pull itself out of your skin the way a mosquito or a black fly could. It's actually anchored in there by these recurved hooks. So a gentle tugging is often a very good way to take the tick out that is feeding on you. And then tick-borne diseases in Maine, again, our most common are Lyme disease, anaplasmosis, and babesiosis. Again, these in people mostly are a summer phenomenon, although we do see cases reported into the fall and early winter and then early spring when the adult ticks are out. In general, rarer are cases known as ehrlichiosis. And then we have this relapsing fever on the bottom, on the middle column, right in the middle, Borrelia miyamotoi. It's a relapsing fever spread by deer ticks, but very rare. We've only had a handful of cases reported over the last 5 to 10 years in the state. And then finally, Powassan encephalitis virus is one that we are also seeing occurring in Maine. It's a viral disease, not a bacterial disease. And again, we maybe get 1 to 2 cases a year, not every year, however. So this is something that we do see on the landscape, but it's nowhere near as common as Lyme disease, anaplasmosis, or babesiosis. And on the last column on the right, the potential threats, these are actually pathogens carried by other ticks that haven't arrived yet in Maine, but they're ones that I think we probably will see down the road in the next decade or so as some more of these ticks move into the state from south of us. And so Lyme disease, again, I'm not a doctor, so I'm not going to talk about like medical advice on how to treat, but for prevention purposes, Lyme disease, there are some symptoms to look out for. Generally, if a tick has been on greater than 24 hours, you have a potential for getting Lyme disease, anaplasmosis, or babesiosis. Early symptoms will include the what's called the bullseye rash, which is an expanding rash at the site of the bite that sort of has a darker red center with a middle pale ring and an outer reddish ring. This tends to occur within 10 to 30 days of your tick bite. So it's not automatic. Fever and chills, feeling fatigue, and muscle soreness or weakness is also an early symptom within the first few weeks. After that, later or longer term symptoms might include things like arthritis, neurologic issues such as Bell's palsy, and then in very rare cases, there have been issues, cardiac related issues that are kind of a late stage form of Lyme disease that have been noted. And again, this is just a graphic showing variations on the bullseye or bullseye rash that is associated with Lyme disease. And a lot of the rash, there's not a common uniform appearance of the rash. A lot of it will depend where on the body the rash is going to appear, and it will conform in a lot of ways to the shape of what part of your body. So a rash that occurs on the trunk, the stomach, or the back is going to look a lot different than a rash that may occur on the arm or behind the knee. So just be aware that these rashes can have various appearances, and again, they usually crop up within 10 to 30 days after taking a tick off of you. And so distribution of Lyme disease cases, the one thing about this map that I do want to note is that it may look from this map that Massachusetts is doing a great job of dealing with Lyme disease because they have no cases reported. But actually what it is, these are actually case reports from the state health departments. And Massachusetts, about 3 or 4 years ago, just stopped reporting cases of Lyme disease because they were having so many of them. And they just stopped contributing that data to the CDC. A lot of the other New England states are going to be going in this route. So I think a lot of this data is going to go by the wayside because as the amount of tick-borne disease is increasing, state health departments, as we've seen the last couple of years, with COVID, they are massively overwhelmed with a lot of different work. And, to some extent, some of the health departments are actually reaching a breaking point. And so looking at stopping recording or reporting cases of tick-borne disease at the county level may be something that happens widespread across a lot of the Northeast the next few years. For us, though, Lyme disease, as I said before, is expanding, and we certainly have had cases reported in counties over the course of time. And this, in a lot of ways, has tracked where the ticks are being found. And so we really think of this now as truly a statewide public health issue. It's no longer restricted to the Southwest coast in York County or Cumberland County. Really, we are having cases reported from every county in the state, including Aroostook and Washington County in down East Maine. So it is something that people and communities statewide have to be on the lookout for. And from year to year, the cases that are being reported, we certainly have years where we have higher numbers of cases being reported and years with a slightly lower number. I apologize, it's my dog in the background shaking himself with his collar. And one thing to note is the years where we actually have these small dips. So we have in 2015, 2018, 2020, kind of a lower number of reported Lyme disease cases. And a lot of times, this is a result of region-wide droughts that we've had. So you all are gardeners, so you certainly know the issues, especially if you're like me and you live off of well water, how finicky you might be concerned with water and precipitation levels. And certainly in 2015, to a lesser extent in 18, but then also definitely in 2020, we had large region-wide droughts that occurred through a lot of the Northeast. And because ticks don't like drying out, because really the drying out is one of the biggest factors of mortality for them, we actually saw a resulting decrease in the number of Lyme disease cases being reported because of the excessively dry or quote unquote drought conditions that occurred up here. Seasonally, again, Lyme disease by month of onset, so when the disease first appears, we really tend to have a big spike in June, July, and August, with lesser cases being reported into September, October, and November, and also April and May. And a lot of this, again, does revolve around the appearance of those deer tick nymphs, which are, again, the very small, medium or middle life stage of the tick that's about the size of the head of a pin. And again, because of that small size, they probably contribute more to the actual human cases of Lyme that we see. In general, though, age class of people getting Lyme disease is kind of interesting because really what we see is we tend to have higher amounts of Lyme disease in a couple of age categories of people. So people who are over the age of 65 tend to report higher amounts of Lyme disease, as well as people in the 5 to 14 category, 5 to 14 years old category as well. And to a lesser extent, people who are 45 to 64 as well tend to be kind of in the third rank of people who have Lyme disease symptoms. And I think a lot of this actually is a function of lifestyle and activities. So people who are over the age of 65, many of them are retired. So they're spending a lot of time doing activities outdoors. So you can either be walking, hunting, hiking, fishing, biking, gardening, or they're outside and they're just exposed to ticks on a greater basis. Similarly, kids who are 5 to 14 are probably outside playing down low to the ground, doing a lot of things, outdoors, and also getting exposed. Of note is the lowest age cohort that experiences symptoms of Lyme disease in green. And this is the people who are age 15 to 24. And a lot of this, I think you can kind of refer to it as the Xbox syndrome or the computer syndrome. kids that age or people in that age category are probably indoors on the computer a lot more. And so they're just not outside as much. They're not outside being exposed to ticks. And so as a consequence, they have fewer amounts of tick-borne disease as a consequence. So, our activities really do play a part in recording tick-borne disease. But, a lot of the other things that we can do during our activities, like dressing appropriately, can actually go a long way towards mitigating some of these symptoms and getting things like Lyme disease. I'm going to speed it along because I've got a couple other things to discuss as far as other tick-borne diseases. So anaplasmosis is another bacterial pathogen that we see. A lot of the symptoms are similar to Lyme disease, with the exception that it does not have a rash associated with it. And this is our second most commonly reported tick-borne disease. It also, like Lyme disease, occurs statewide. So it is something that we do see on a regular basis. Like Lyme disease, however, it is very treatable with a common antibiotic called doxycycline. And anaplasmosis, the recovery from with doxycycline is very quick. And so even if people will feel terrible with a lot of symptoms from anaplasma, they usually tend to feel much better after even a day or two on antibiotics. And then following the full course out of about 3 weeks will actually take care of the issue with this. But again, it is something that we do see in Maine in the last 10 years or so. The numbers have certainly increased quite a bit. And you can see this from this graph as well, where it does occur statewide. And like Lyme disease, we have years where there's higher numbers. And again, a lot of this does tie into, as I said before, our droughts that we see in the state. Babesiosis is our third most common tick-borne disease that we have. It is one that can occur from the bite of a tick, but can also occur because this pathogen actually lives in the red blood cells. It has also been reported as occurring through blood transfusions. And so organizations like the Red Cross now screen many of the northeastern states for this tick-borne pathogen in the blood supply before it's being used. Babesiosis, though, is a little bit more restricted. We tend to have little hotspots of it occurring in York and Cumberland County, with a couple of rare cases being reported from the Capital Region and the Mid-Coast, Upper Mid-Coast in Knox County. But by and large, most of the cases of this tick-borne disease are being reported from coastal York and coastal Cumberland County. This is also, in most people, it occurs as a fairly mild illness. However, people who have had issues with the health of their spleen, or have had their spleens removed, or have a weakened immune system, may suffer more severe complications from it. And again, you can see that again, the Babesia cases are actually quite low and really restricted to some of our coastal counties. And so I'm actually going to only talk about this slide, Powassan encephalitis, because it is a disease that's a little bit different than the others that we have. And again, we have maybe 1 to 2 cases a year being reported. In 2013, we actually had a fatality from Powassan virus occurring in the Mid-Coast area in Knox County. And this is something that has sort of been on the increase since about 2006 in the Northeast. More people are reporting cases of this disease because it's a viral disease and can cause severe neurologic problems. We have had more fatalities from it being reported since then. And many of the people, however, that do not die from infection with Powassan can have long-term neurologic problems, in some cases going out a decade. However, we tend to find that it is, although widespread geographically, so it's very possible we could find it in almost every county of Maine, we actually find that its presence in the ticks is quite a bit lower. So when we do a tick survey, say we'll go out to someplace in Lincoln or Sagadahoc County and do a tick survey, we may find that the infection rate with Lyme disease in those ticks, maybe 40 to 50% of the ticks are infected with Lyme. By contrast, usually only about 1 to 2% are infected with Powassan. So the number of the amount of infection is actually quite a bit lower than Lyme disease. But it makes up for the fact that it can be a much more severe illness as a consequence. And again, some of these other ticks, these other tick-borne diseases like ehrlichiosis, are carried by Lone Star ticks, which are not yet established in Maine. However, the amblyomma tick does occur down south. And so people that are traveling down to southern regions of the US can certainly encounter these Lone Star ticks and come up with some of these other pathogens like Ehrlichia. Rocky Mountain spotted fever, as I said before, is transmitted by dog ticks as you go down to the southern parts of the US or out towards the Rocky Mountains. Again, we do not have that yet as an issue here, but Rocky Mountain spotted fever also is quite prevalent in dogs as well. However, it is very treatable with antibiotics. And so if and when it does appear here, at least, it is something that I think is pretty manageable. In general, so I think a lot of clinicians would probably tell you that really, getting in touch with a doctor or your primary care physician is very good following the removal of a tick bite. In most cases, many of these tick-borne pathogens are treatable with antibiotics. In general, the antibiotics are about a 3-week course of time, and it is generally regarded that you should stay on the antibiotic course for the entire 3 weeks. Powassan encephalitis, because it's a viral disease, is not treatable with antibiotics, and pretty much patients have what are called recuperative therapy, which means if your body will recover from exposure to the virus, then it will do that at its own time. And so, in many cases, it means that really folks should really be on the lookout if this is occurring in their area. There are treatment guidelines as well, which you see at the bottom is a link to that, which are treatment guidelines for clinicians. But in general, we've actually had some real success, at least in informing doctors and nurses in southern Maine of the increase in tick-borne diseases. And by contrast, back in the 90s, it was a real chore to really get the information out. This was occurring in the state. And I think that a lot of the docs now have become much more aware of the presence of these tick-borne pathogens. And so it is something that is on the radar for them, especially when the summer season starts. It is sort of a go-to thing to look at for testing if patients come in with a lot of flu-like symptoms during the summer season. But a lot of the tick bite issues, a lot of this is manageable. And even though some work and some studies have really shown that most tick-borne diseases occur in the peridomestic or around homes, not as much tick-borne disease occurs from going out and doing recreational activities like walking, like going hunting, going fishing. A lot of it is people get ticks around their homes, and frequently it's because they make very short trips outside and just don't think to do a tick check coming back inside the house after a quick run out to the garden, after a quick run out to the wood pile, compost pile, stuff like that. And when we're going out and actually recreating, I think that's when people think to wear the light-colored long sleeve clothing. Wearing your long pants that you tuck your pants into your socks. Using repellents when we're going out for a walk, and then doing tick checks on themselves, or if you're going out dog walking on your pets. But a lot of people don't really do that when they just run out into the yard for 30 seconds, for a minute, or for 5 minutes. But I think if you're living in an area where you have ticks, this really is a constant amount of vigilance that you have to do, because it's not uncommon, I think, to go out and just, my wife certainly is, has this happen to her all the time. She'll run out to the garden, and we have a wood edge line near part of our gardens, and she'll frequently come back with ticks from just running out there very quickly. The other thing that happens if you have dogs or cats, and if the cats go outside, certainly they also can bring ticks into the house as well. And it's not uncommon, and we see this all the time, where our dog, who, like a lot of dogs, probably loves the couch and likes to hang out with us on the couch. And our cats will frequently jump up as well. And it's not uncommon to see a little hitchhiker jumping off onto the slipcover after the cat or dog has been there, cruising along. So it is a really good idea to actually check your pets as well and put on a lot of the anti-tick medications that you can get from your veterinarian, and to keep up with that as well. And usually a lot of those are a once-a-month treatment. Many of them now are oral for dogs, so it makes it very easy. And then the cats have the top spot medicine you can put between the shoulder blades that actually works for flea and tick prevention. And they do tend to be pretty effective at killing the ticks that get on your animals. And then finally, repellents, which are on the bottom right, are kind of our front line of defense in a lot of ways, especially repellents that go on clothing. If you guys have a set of clothes, like what we do for our work, for our survey work, we have 2 or 3 pairs of clothes that are just there for going and doing field work in with ticks or mosquitoes. And as a consequence, these are treated pretty regularly with repellents like permethrin, which goes on clothing and can last for several wash cycles. And it actually, goes pretty well. It does a real good job of deterring ticks from getting on your clothing. And we have noticed that when we go out and do survey work, people that don't have things like permethrin on their pants tend to get a lot more ticks on them and hanging on their pants a lot longer. So wearing light colored pants, light colored clothing, and then treating those with repellents is a really good idea. Permethrin, I like to tout a lot because you can apply it once to a pair of clothing, pants and shirts, and it will last for 7 or 8 wash cycles in dryer cycles. So you don't have to do it every day. The one thing about permethrin that's a problem is that when it's wet, it can be toxic to cats. So we usually tell folks that if they're going to spray their clothing to put it in an area like a garage where the cat may not have access to and let it dry for about 24 hours. And then they should be good to go. Permethrin is not that expensive. Can of it may cost $5 or $6, and you can get it from a lot of the big box stores as well as most outdoor supply and garden centers actually carry it as well. And again, it tends to go really well on clothing, including nylon clothing. So if you have sort of like the lightweight, kind of running pants or something like that you're wearing, that will go pretty well on that, or a windbreaker. However, it doesn't stick as well to things like rubber boots. So if you have rubber Wellingtons, like gardening shoes, it doesn't work as well with that. But certainly spraying your pants is a really good idea for protecting against tick bites. And this is just a kind of a swath of just the different products that might be out there. A lot of them contain the compound called DEET. And DEET is pretty effective at repelling mosquitoes, black flies, and ticks. And it can go on your clothing as well as your skin. However, it's generally recommended that you don't spray it directly on your skin, that you spray it onto your hands and then kind of rub it in. And also, it will need to be reapplied. Especially if it's raining or if it's particularly hot and you're sweating. So with DEET, there are different concentrations that you can get. And in general, concentration of DEET that's around 28 to 30% is going to be very effective at preventing and repelling ticks. Anything more than that is generally thought to be excessive and unnecessary, and anything less than that will work. However, it will probably need to be reapplied more often. So you certainly can get DEET in a 15% concentration or a 20% concentration. That may just need to be applied more often than the 28% concentration formulations. But DEET does occur across a variety of different products, and it is quite easy to find as well. In general, when people are finding ticks on them, they generally have areas the ticks tend to settle in and feed. So unlike black flies and mosquitoes that really can and start to attach and feed, they tend to like areas that are not being excessively exposed to light, and areas that tend to be kind of darker and warmer. And so areas like behind the ears, at the base of the skull, in the groin, around the ankles where you might have socks, and then also in areas like around the armpits are all areas where the ticks may eventually settle in and start to feed. Again, it might take ticks quite a while to actually settle in and start feeding on you, because they may be walking along your skin and they may be getting rubbed with fabric as you're moving, like on your elbow or your knee, and they may decide that they just don't like that. And so they may just move to another area. So again, another reason to do tick checks pretty often is because these ticks don't start feeding right away. Finding the ticks before they start feeding is, a real benefit, and it really helps to decrease the amount of tick-borne disease in people. So if you go online, and I will admit freely that I'm not on Facebook, so I am kind of missing out, I'm sure, on a lot. But when I talk to my wife, there's all kinds of remedies that people put on Facebook on how to remove ticks. And there's a lot of stuff that actually doesn't work or could be almost blatantly unsafe. And some of those methods might include using a match or a lighter to heat some metal that you then apply to your skin to get the tick to remove itself. But in general, what we find is that there are a bunch of different tick removers. And an example of this is like these little tick spoons that you see on the right, on the bottom right here. Or on the bottom left, a very fine pair of tweezers that will work to help just remove the tick very slowly. And really what you want to do is you want to lever the tick out, kind of similar to removing a nail from wood. You kind of want to leverage it out by the head and just essentially crowbar it out so that all of the tick, including the beak, pops out from under your skin. This may take some patience because, again, if you remember back to that earlier slide where it showed the tick having those recurved barbs, makes it very difficult to actually get the tick out of you. So just very, very patiently using slow motion to really just pull the tick out gently will actually help to get it out and leave nothing behind, essentially, which is really what you want to do. If the head is remaining, if you happen to pull the tick out and you end up leaving the head in, there's generally no issue with Lyme disease or other tick-borne diseases from that, but you can get a secondary infection similar to what would happen if you had a splinter get lodged into your skin. Eventually, you'll probably slough the beak of the tick or the head off the same way you would with a splinter or a thorn. But generally, anytime you take a tick off, you should really apply a topical antiseptic after removing the tick. And in general around yards, really one of the things that we do talk about is really trying to clear your brush away from areas where you have a lot of peak activity. And so these photos here on the right are from the Connecticut Agriculture Station down in New Haven. And they do a lot of work on kind of residential tick control. And what they found is that by, taking the brush and taking leaf litter away from where you have a lot of activity like this playground set, you actually can help to reduce exposure to ticks because ticks don't like to cross open sun. They don't like a lot of wind to get to people. One of the things they do suggest is putting some kind of a border or a barrier down around the wood edge of a lawn. And this could either be stone or it could be chips like mulch or something that kind of creates a drier barrier that the ticks are not going to want to cross over to get onto the lawn. And that may also help as well behaviorally, especially if you have kids or if you have dogs and have to put an invisible fence out. You can actually line it along this barrier as a means of having your dogs stop before they get into the woods if they're running around. And again, removing plants that are going to bring up close to the house or an area where you have a lot of activity, reducing that shrub layer as well is going to be very important. And then also, if you are planting, because deer seem to be so important to the presence of ticks, removing plants that are going to attract deer in. So removing plants that deer find very desirable to eat from areas where you have a lot of activity in your property. This is actually a lot harder than it sounds. And I'm sure all of you know just the wonderful joy of spending so much time putting plants in the ground and then coming out the next day to find them completely mowed down by deer during the overnight. So it actually can be quite a challenge to find plants that deer don't like to deter them because they really seem to like so many that we plant in the ground. But really trying to, deter that in some way, or deter deer onto your property is also a great way to help reduce tick-borne disease and ticks as well. If you do find a tick on you or your pet or your kids or your grandkids, you can actually send it to the University of Maine up in Orono. They have a lab up there that they will actually do identification of ticks, and they also will test ticks for pathogens from the general public. Generally, they would request that you put the tick in a crush-proof and waterproof container with alcohol. Generally, rubbing alcohol is just fine. If you come in from the field and you are worried that you might be exposed to ticks, obviously doing a tick check is a great idea. However, putting your clothes in the dryer initially, as soon as you come in, if you have field clothes that you're wearing outside, putting your clothes in the dryer for 15 to 30 minutes on a high heat cycle will actually help to kill the ticks on your clothes before you put them in the wash. Just putting your clothing in the wash without things like chlorine bleach will not kill the ticks on their own. So the things like the general detergents that we use, so anything from Arm & Hammer to Tide, any of that will not kill a tick. However, chlorine bleach will. So if you have white stuff that you're putting in, obviously you can use chlorine bleach. But the high heat of a dryer will actually go a long way towards killing off ticks that may be crawling on your clothing. And then this is the address for the University of Maine, where you can send ticks for identification and testing. And I think we can probably call it there. I think this is the last slide that I have actually. So. So I guess if you want, we could take questions if you have any, and I can stop the sharing. Here we go.
Okay, thank you. Question, is there anybody here who has had Lyme disease? Or any of the other strange things? We've got a couple people who've experienced it.
Yeah.
We
Yeah.
had a garden club member a couple of years ago who had a tick bite that caused an allergy to meat.
Yes.
That was the Lone Star one, Becky.
Was it? Yeah.
That was the Lone Star one, which is very rare here.
Yep. And so that issue, what the scoop with that is that the Lone Star ticks apparently will have something in their saliva that causes a reaction against the flesh of hoofed mammals, which sounds a really strange thing to say, but it's not just a quote unquote red meat allergy, because it actually will affect things like pork or any kind of hoofed mammal. So things like venison, moose meat, if you're partial to goat or camel, that would also affect those animals as well. And what happens is there's something about a carbohydrate that exists in that meat that reacts against the tick saliva. So after you've been bitten, it does trigger that allergic reaction. The problem we run into is because this is an allergy and not an infectious disease, it's not a reportable condition yet. So it's sort of like we oftentimes hear about a case of a red meat allergy a long time after it's happened, and so we actually haven't been able to confirm that it was caused by a population of ticks in state. A lot of times people will pick up Lone Star ticks and they go on vacation down south and they get bitten and then come back to Maine and then get sick as a consequence after returning. So it is the kind of thing though where we certainly are on the lookout for those Lone Star ticks though, because they are really a game changer for us if they get established here. So
I have a question about the spoon that you can use. Where do you get those and how does it work?
So essentially you can get them, you can buy them online. Certainly there's a lot of different, you can go to Amazon or any places like that, you can get them. Our local True Value actually carries them. So you can get them at a local True Value, an outdoor supply store. Some garden centers actually carry them. And generally you kind of use it the same way you would a pry bar. So the spoon has a small notch in it, like a little V notch, and you line that V notch up at the head of the tick and you just leverage the tick out. So it falls in the spoon. So it's there captured in the spoon. And then you can drop it in a Ziploc bag or a small container if you want to send it off to be identified and tested. The one thing I will say about the spoon that actually works really well is it works really well with kids, because it's not a bright, sharp, pointy object that you're pulling, putting towards them to pull something out. So it's not really a very threatening thing. And for some reason, we found that dogs also don't mind the spoon as much either. Dogs tend to work, the spoon tends to be really non-threatening for a dog as well. And it works really well to get the ticks out, actually. Some vets will give them away. We had a vet in York County that used to get. You may be able to contact the Maine Center for Disease Control, because I think they do occasionally give them out, like for groups, like for a special public health fair or like some public health event. They may actually hand them out. So you could also try contacting the Maine Center for Disease Control and see if they have any available to give out to like the garden club members or something. So.
Thank you.
Excuse me, this is probably a dumb question with the spoon. Do you go at the tick from the head or the tail?
You actually go underneath the tick near the beak and just kind of leverage it out. So you try to get down as close to the skin as possible with the notch, and it just leverages out the way you would like a pry bar, nail with a pry bar. So
okay, thank you.
Yeah, sure. Yeah.
I have a question about tick tubes.
Yes.
Do they work? I know they have the permethrin in them.
Yes. So the answer is yes and no. They do work. So the tick tubes are a device that has permethrin that is sprayed onto cotton balls. And the cotton balls are stuffed into these cardboard tubes. And what happens is mice will come along and grab the cotton batting and they pull it out and they bring it down into their nest. So it helps to kill the ticks that are feeding on mice. However, although it does work and it can be very effective, it doesn't work as well if you have a lot of other things like chipmunks around, because chipmunks tend to host ticks as well as mice do, and they don't really care about the cotton balls a whole lot. They don't really worry about them. So it does work, and we usually will tell folks that, really, if you don't have a lot of chipmunks around, you're probably still going to have mice. So the tick tubes may work pretty well. There is a bait box that is produced that you can use against rodents, and it works against both mice and chipmunks. But I believe it has to be installed by a licensed pest control applicator in Maine.
Well, I also don't want to do anything that's environmentally irresponsible.
Yeah, and so the bait boxes have like a little wick in them, so there's bait for the mice and the chipmunks to run in, and then as they run into the bait box, they're actually covered like in a little mini paint roller with this insecticide on their back that helps to kill the ticks. So it has the benefit of not having a lot of like the bait boxes are made of a pretty heavy rugged plastic, so they don't break, so there's not a lot of leakage from them or a spilling of the compound. But they do work pretty well against both chipmunks and mice. The tick tubes, though, we have found that especially if you do have a lot of mice as your primary rodents that are around, they are pretty effective, actually.
Okay, thank you.
Yeah, sure. Yeah. Oh, and you can get them over the counter as well. Like our local.
I've used them before.
Yeah. So a lot of your local True Values will carry them. Some of the the Aubuchon Hardware, stuff like that will have them.
And Brooks Feed and Farm has those spoons, by the way.
Oh, okay. Yeah. All right.
Any other questions? I think we had a couple in the chat, but I think they've been answered.
Tucky's got a question. Unmute.
You're muted, Tucky.
Just working on it.
It's down in the bottom corner where it says mute or unmute.
Or the top of your picture. Top right-hand corner of your picture.
In the corner of your picture, it says unmute. Right where your picture is. Look at you. Oh, well. We'll read lips.
Here I am.
There she got it.
Thank you. Chuck, I thought this was fantastic. Thank you.
Oh, you're welcome. Thanks.
If you use the spoon, can the tick jump out of the spoon?
No, but they certainly aren't. They're not killed by it, so they will
No.
crawl. So we usually tell
Right.
folks to have the container close by
Ready.
and to just drop, tip the spoon into. One of the things that we actually were telling folks for a while is that if you've got any leftover, so the containers that like things like Tylenol, a leaf come in, pill bottles, stuff like that, they actually seal really well. So you can actually, like what we do is we keep our old medicine bottles and we actually have that on our counter as like our tick, our tick collection right there. And so every time we pull one off the dog or the cat, we just have it filled with alcohol and the ticks just go right in and they just drop to the bottom of the container and they die, in the alcohol. So we use a tick spoon to get it off the dog or the cat and just walk right over and just, dump them into the container with the alcohol. And then it seals up nicely. So if it gets knocked over, something doesn't spill or anything. So
I also keep Scotch tape in every room in the house.
Yep.
And, that works really well to pick them up.
Yep. I mean, I admit we did have a guy who was a farmer out in Buxton one time that used to show up every spring with a half-gallon mason jar, probably filled with moonshine, that had about 2,000 ticks in them every year. You know, I think folks in general would like a lower number if you're going to send them into the humane. They don't like a gallon mason jar probably, but you know, slightly smaller containers with alcohol are probably.
Yeah, and it's just another reason to get out there and fight those invasive plants. Yeah.
Yes, it is actually. Yeah,
Yeah.
it really is.
A number of us here volunteer with the Invasive Plant Partnership in town, and
Yep.
it's a devotion. You just get out there with your long pants and your like permethrin shirts and just
we had an intern a couple of years ago that was so happy when a barberry thorn that she had caught in her leg came out after 4 months. So, you know, and the Japanese barberry is just,
barberry
oh,
is really nasty and
it's insidious. It really is. Yeah. So so we end up wearing some pretty rugged pants, at least if we're out doing our field work a lot of times.
right.
You know.
Yeah, they'll get through anything. I had to go leather gloves. Yeah.
Right. Yes. Right.
But better that than ticks. So
Yes.
taking volunteers for Invasive Plant Partnership. See me. We'll be out there working again. Anybody else have a question for Chuck? Well, thank you. We so appreciate this.
Oh,
And
you're very welcome.
yeah, it's
Thank you
good to
very
know the
much.
things we can do at home to kind of keep them at least away from the house and yard. Yeah.
Yeah. Good. Excellent. All right.
Thank you.
Becky, you're being asked if we can get a copy of the slides.
I can send you a PDF.
If you want to send it to me and then I can distribute as needed,
Yep.
that would be terrific.
Yeah, I can do that. That'd be pretty quick.
Be great. Thank you.
Okay, great. Sure.
Okay.
All right.
Anybody
Well,
else?
have a great
Thank you
spring.
very, very much.
Thank
You're
you.
welcome. Thanks. Okay.
Okay. So I've got Chuck, I've got our next garden club meeting will be on Zoom. It will be in April 21st, and Suzanne is going to guide us on a virtual tour of Harpswell's Gardens.